Walk off with an iPad, and I've got a sheet of paper here. It's I appreciate the opportunity to be here this afternoon, and certainly want to start by acknowledging the work that you all have done in this stewardship project to advance the dialogue and conversation about health care generally, which ultimately led to the passage of the Affordable Health Care Act. I think this group had an integral role to play in the passage of that bill, and hopefully will have an integral role in making sure that folks across the country understand precisely what that bill does for them and how important it is. You may think it's strange that the Secretary of Agriculture would be here addressing you about the topic of health care, but it is an issue that really does impact and affect folks in rural America. Under the old system, before the passage of this bill, we in rural America basically paid more for our health care per capita than anyone else did in America. We had a higher level of uninsured. We paid more out-of-pocket expense for our health care. We had an aging population. We had a significant number of self-employed and small business owners who struggled with trying to figure out how to afford the cost of health care. And with that aging population, we obviously were dealing with Medicare Part D and some of the donut hole issues. So the passage of this bill, which expands health care coverage, which provides tax credits for small business and self-employed individuals, that fills the donut hole, all of that is extremely important in terms of the viability of the rural economy and rural America, which, by the way, is the source of most of your food, your fiber, your feed, an ever-increasing amount of your fuel, and about 85% of the water that you consume. So it's a fairly important place for all of us. But the reason I'm here today is to talk about that aspect of the health care bill, which I think is ultimately one of the most important aspects, if not the most important. If we're really going to get control of our health care costs in this country, we obviously have to focus on prevention and wellness. And that's something that the Stewardship Project understands and appreciates and has advanced. And I think we have a tremendous opportunity to build on what the Affordable Care